RTD employees reported nearly 70% more on-the-job injuries last year, and exposure to drug smoke was cited hundreds of times. RTD workers can now get paid leave if they need time to recover from exposure. Our Kelly Rinke takes a closer look at RTD's well-known drug problem.
Across the country, we've heard about assaults on transit workers, but something in the air is also concerning RTD employees.
The long-term effects of it, exposure, are very concerning.
Union President Lance Longenbahn says his members are worried about being exposed to drug smoke on their buses and trains.
But it's also one of the things that's affecting RTD's retention.
The problem impacted operators so much, last year RTD agreed to place employees on paid administrative leave if they feel impaired.
It gives an operator the completion paid completion of the shift that they're relieved from and the following day to recover from the effects.
RTD says employees reported an exposure to drug smoke more than 350 times last year, meaning it paid more than $60,000 to operators to take administrative leave.
They're not making the decision about whether they should not operate their vehicle based on pay. They're making that decision based on how they feel.
Those feelings are shared by transit workers hundreds of miles away.
The transit agencies reached out to the University of Washington.
Dr. Marissa Baker and other researchers at the University of Washington collected samples from buses and trains on the West Coast.
We consistently found methamphetamine in the air and on surfaces, even at and near the operator.
Whether detectable amounts of drugs has long-term health impacts on operators is a question they didn't answer.
There haven't been studies that have looked at kind of the long-term impact of exposure to secondhand drug in a workplace environment.
An answer Denver workers couldn't wait for.
It's a safety matter.
Now, if an operator wants to seek medical care, they submit a workers' comp claim. RTD would then pay for that exam. The district paid more than $45,000 last year in workers' comp for these reports.